All right. So we're taking your questions online. It's about physician entrepreneurship and building a brand. And a very common question that we get is what side gigs can physicians do outside clinical medicine? I think I can think of a couple here. What do you think, Anne, here?
Yeah, we can definitely spend at least hours talking about this. So, doctors, in this episode, we're going to just talk briefly about the things that you can think about that side gigs. So, I'm Dr. Ann Truong,
I'm Dr. Mike Wu-Ming.
and we are the founders of the Doctor Boss because we want you to own your life and your time as well as build financial stability. So many questions that we get about entrepreneurship and also clinical side gigs. And this question asks, what side gig can physicians do outside clinical medicine?
I think that you can put into a lot of different categories. When you first start is what I recommend and when you're doing a side gig is like, what do you already know? Like, what do you want to do outside clinical medicine? What is your expertise? That's often the easiest. And I think that's even a better question. Is what side gigs should you start outside clinical medicine? So you got a number of them. First is education, because most doctors, we like to educate. We like to create content on there. So that could be as simple as teaching outside your clinical practice. I mean, we know the established things such as like teaching at a medical school or teaching for residents. But then once online came, you can actually start your own business by writing. So one of the first side gigs that I did was medical writing. I wrote for medical like USMLE board style questions. I did that. I used to write for, I don't think it's out now, but it was like a Wikipedia, but it was for doctors. So I used to write content for that. I write for medical journals. I've written for Medscape. I've written for other magazines, other journals on there. You can start your own blog. You can start YouTube. You can podcast. You can do board preparation. The education is one. Second is what we call medical adjacent. So things that related to your clinical practice, but you do this in another arena, such as expert witnessing or doing independent medical exams, utilization management, peer reviews for journals or insurance plans. Third, digital health, not necessarily completely out of clinical medicine, but telemedicine is one. Creating your own app, doing medical writing, there's just so many. I don't know where to start on here. You've got investing. You can do starting in like physician financial education, starting your own financial blog, getting involved in real estate investing or investing in other areas such as angel investing. Those are the top three that I can come up with. What about you, Anne?
Well, I lean towards your expertise in not going outside clinical medicine, but utilize the clinical training that you have and turn it into an asset that somebody wants to pay you for. So my coach, Alex Hamosi, said, if you can educate, you can market. As physician, we educate day in, day out. When we see our patient, we educate them about the treatment plan. We educate them about their disease and the progression. So lean into that, and you can go online and create courses. Let's say you're a rheumatologist, you can create a course on how to eat to reduce RA flare up and exercises for RA flare up. And do you need steroids for RA flare up? You can sell course. And then on top of that, from the courses, you can also ascend to do group coaching. If people do the courses, they'll have questions. And then you can offer a group coaching Q&A along with that. And then from there, people want to ascend and go to see you in the office. So you can lean into your expertise in creating what I call digital asset and digital real estate. So you can go from group coaching to one-on-one coaching, what you can charge more for one-on-one. It could be half an hour on Zoom, 1 hour on Zoom. And then you can also do webinars. You can do a live webinar. And then from the live webinar, let's say you do live on YouTube, and then you can say, hey, if you want more information, you can do paid webinar where let's say you charge $50 a registrant and you have about 100 people sign up. That's $5,000, right? For an hour. That's not bad. But, I just want you to know that You don't have to be totally outside of clinical medicine. You can still use your clinical expertise, but in different fashion rather than just seeing patient in the office. So those are the things that I think of at the bat that you can literally launch in a few weeks. You can literally go live tomorrow and you can just create a Instagram or TikTok or YouTube. I love YouTube because YouTube is evergreen. And once you create the video, you're there. I have a video that I made 4 years ago that people are still watching, and I'm still getting paid from Google for ads that are generating from that video. That's what I call passive income. And another way is that you can be, since you're going to be on developing your brand on social media, you can be a brand ambassador or even a paid spokesperson, which I do both. I help brand develop their products, as in supplements or a medical device. That's consulting. And then I'm also the spokesperson where I talk about the products to my social following. It has to be aligned with what you're talking about in your social media or your niche or and your avatar. I teach men on how to naturally restore sexual function from erectile dysfunction, but it will be weird if I talk about a mind map, a device for mind map. I would want to talk about things that align with my niche. Fortunately, there's a lot of products that align with my niche. So I'm a spokesperson, and then I also do consulting. And then you can also help brand build a marketing campaign about their products, because a lot of brand wants doctors to help them develop their product as well as become the spokesperson as well for their products. So you can get on the ground to working with brand, but the only way they know about you is that you get on social media, because that's really your CV, your digital CV online. What else can I think of? These are the things that I'm thinking of. Oh, and don't forget, you can also do a live workshop. In my office, sometimes you have office space, they have a conference room. And you can use that conference room and do like a live workshop teaching people about your heart doctor. And you can teach people about how to prevent heart disease. And if you're OBGYN, you can talk about how to prevent postpartum depression or even weight loss after postpartum. These are common questions that people ask and common condition that people struggle with. They just want to hear from somebody that is credible and has authority. And as a doctor, you already have that credibility and the authority. You just need to let people know that you're available to offer the services. So just think about those things the reason why I mentioned that, because you can literally launch that next week, because you have access to a conference room and you have your patient list, hold a live workshop, and then you can charge $50 for that. People pay $50 for do their nails, but let's say you have 20 people or 100 people. It's not bad change for just a few hours of work that people will pay for to get the information that is in your head here. So don't keep it here. Find ways to help people. And now we have online, and then I talk about digital workshop, and you can all go as far as holding a summit. You can do a summit like what Mike and I did in January, where we held an in-person conference on teaching doctors on marketing and podcasting. Anything else, Mike, that you can think of?
The thing is, it's not necessarily like what side gig you should do, but the ones that who have done well with side gigs is they don't treat it as a side gig. They treat it as something that can be scaled and that it can grow. And it's not just creating another income stream. It's not substituting time for money. When you go into a side gig, you actually should like enjoy it. Like you would like to do this. You know, if it's you're doing it for just another job, well, you can do that, just getting the same clinical job, and you'll probably get paid a lot more, at least initially. But the ones who have been successful that I've worked with are ones who say, you know what, I waking up and I'm excited to get started on this. Our side gig, and I don't necessarily call it a side gig, is education. And we love to teach doctors about building their own brand, getting it online. The time of this recording, it is like really early in the morning for me, but I enjoy doing it. I love working with our clients, our students, and those are going to be the most successful ones, is doing something that you'll like, where like you might not even get paid for it, that you just enjoy doing it. So let's go into the next question, Anne, which is kind of pretty much similar, is what are successful non-moonlighting physician side hustles? So we've named a lot of different side hustles, but which ones specifically have worked for you or worked for your students that seem to be the most successful? When I look at doing successful side hustles, it's not about getting another job, as I just mentioned. It's about side hustles that are scalable, that can grow without you, where you stop trading time for money, where you're building leverage through creating an audience and an expertise and an offer on there. So ones that are scalable is things like building your own brand, building an audience, things that we talk about all the time, building your own blog, a newsletter, your own YouTube channel, building your social media presence, building brand deals. Those are things that you do at once and you can still get paid on it. Anne just mentioned she could still get paid on content that she created 4 years ago. She gets created on her credibility that allowed her to build six-figure audience on YouTube. So focus on creating a blog or newsletter, but you have to niche it. You have to be specific, whether it be in financial advice, whether it be on helping other doctors build their own practices. Do something that leverages your expertise, and you can monetize that through ads, through sponsorship, by creating your own courses. Other ways that you could have scalable income: real estate, learning about investing, learning about publishing courses. You can even start with like digital products. I started with digital ebooks, but you're not going to get make that much money on it. But what it does is allows you to build your audience, building credibility, selling courses, selling workshops, as we've talked about as well. Another side gig that has done well is physical businesses, like starting up your own aesthetic practice where it's not you necessarily as the provider, but you as the owner, and you hire other people, whether it be NPs or PAs or RNs, to help you grow healthcare adjacent things, maybe other side businesses such as healthcare staffing company, a medical transportation company, investing in other businesses, being a franchise owner, investing in a surgical center. Those are all things that if this is area where you have some knowledge in, that you could really do well in. And that's why I say with like I've known doctors who've retired or they've let their license expire. Try not to do that. Well, your medical license can allow you to go into businesses that others can't get into. There's a barrier to entry. So even if you're not actively practicing, just having that does open some doors for you that others may not get into.
I love that you say that. And to piggyback on what Mike said, and if you are thinking about doing online and building side hustle and be able to make money online, you have the expertise, right? At your clinical training and your degree, and you got to build your audience. That's why you got to be on social media and grow your audience. But the one thing now is that you don't have to have 100,000, 10,000. You can have like even 1,000 followers, but the one thing is that if you're going to do a side hustle, it'd be nice to have some revenue behind that, right? That to have an offer is an exchange. Offer is a service or an asset that you trade for money, and to have an offer that somebody will want to pay for. And an offer, sometimes you got to investigate what the people are willing to pay for, and what if people willing to pay for one time, what people willing to pay for recurring. So once you get that offer down, you can tweak it and you can make it irresistible. And part of my journey in going online and figuring out how to monetize online, and now we're online, we're able to have at high seven figures and hoping to go to eight figures now to just monetize online, to figure out how to turn a viewer into a buyer. But what is the offer that they want that's so irresistible that they feel stupid saying no for? And that if you talk about the offer and you say the price and people go, oh, that's it? That is the right offer. But that takes time and tweaking. Sometimes an offer is like a package. It's not just, oh, I'll just sell a course. I would tell you, Doc, if you want to sell a course and just say, hey, go online to buy my course, that's going to be hard because now people can get information now from AI and it's free. So people may not want to pay for a course, but AI cannot offer accountability, cannot offer live feedback, cannot offer customization of the question and the problem. And so if you're going to do an offer, you want to package it with a digital asset like a course, and then along with live Q&A and even accountability, a workbook, maybe even like an interactive app. So you got to have something that hold people accountable, as well as Q&A, and then also community. Create the community where they feel that they belong in the community. If you create those three things in an offer, then it's going to be sustainable and people will want to stay, and you're able to grow that at this point. And I'm creating that for my dysfunction group right now. We've been doing that for 4 years, and Mike and I are creating that right now for the doctorate community, which is our Doctor's Inner Circle, as well as our Doctor's Online Success group in school. If you join our Doctor Online Success at doctorsonlinesuccess.com, if you go to the link down below, when you join, you get access to the course we already made. There's a community of doctors in there, as well as Mike and I will be available for once a month for Q&A. So we walk the talk and talk the walk. So we are in the trenches with you at the same time right now. So we're not giving you theories, we're actually doing it, and we're seeing what works.
Yeah, I like it. Again, at the end of the day, you want to do something that you like. Those are the ones that have been more successful. Where you go, I could do this for free if I want to. Those are the ones that seem to do well. And you don't want another job. You want to do something that inspires you, that challenges you, that excites you, that has room to grow. Those are the ones that have always been the most successful. And the easiest ones are ones that you have already established knowledge on it. I say the same thing again and again and again. Those are the ones that do well. I give this story of a doctor who wanted to start a side gig, and he started a restaurant, Thai restaurant. And I said, "Why did you open this restaurant?" He says, "Well, I like Thai food." Well, you need to have a little bit more than just because you like the food. And you can guess what happened. He closed within 6 months because he
Oh.
got into an industry that he didn't understand. He
Mm-hmm.
didn't know. He didn't have connections. And he just knew that he liked the food. So just because you like to get into it, that certainly can be the start of it. But you need to have knowledge. That's why it's important to have mentors who've been there, who can shortcut your success. So if you want to build your own brand, if you want to get into entrepreneurship, and you want to be surrounded by like-minded doctors and being accountable, I invite you to join our free school group, Doctors Online Success. You can find it at Doctors Online Success. What are we there now? Over 200 plus doctors that are in there that are talking about these kinds of things. They're talking about side gigs, not just talking about it, actually doing it. We recently started a new one on understanding AI and how I'm using AI in our own practices, how it's building our brand, how it's multiplying what we're doing, how we're getting the things that we were talking about, content, getting it done, pennies on a dollar without spending thousands of dollars on employees, but using AI to our advantage. Go ahead and check us out at Doctors Online Success. We'd love to work with you. We'd love to have opportunity to learn and push people to be more accountable and to scale and grow their online businesses. Anything else, Ann?
No, I think that is it for now. And imperfect action better than no action at all. I hear this from doctors a lot. Oh, I want to make sure this is all set up. I make sure it's perfect. I gotta get this done. I gotta get this done. You know what? All you really need is this. Sometimes you get started on social media. All you need to just has a phone, has a good microphone. You don't need a lot of equipment. Now the barrier to entry to building a brand and social following is almost zero. Because you got this, you can build a brand. I know an entrepreneur that make over $1 million just from using her phone to do videos. That's it. Her phone. She doesn't even have a computer. She built a
Mm.
website from her phone. And so it's a mindset shift that you have to start. Better to start imperfect than to be perfect, because and you start, you're gonna refine it, you're gonna get better. All of us start when we're not good, we're terrible. The first video I made was horrible. It's actually online on YouTube, the first video I made about 5 years ago. But we always get better. It's like med school. Remember when you became person attending, you were unsure, and then 5 years later, you got it. So we want to pay it forward and have doctors understand that you don't have to be trapped in the golden handcuff with insurance. There are other ways now that you can leverage your medical expertise now to online, to build asset online and monetize, or to go explore real estate or consulting, other side gig that Mike talked about. Now, will it replace your physician income? Maybe, but it's additional. But it's also what I found is that when I do this, it really makes me fall in love with medicine again. Because when I do this, it gives me, I guess, a variety. I appreciate being a doctor and I appreciate the skills that I have. I like medicine more now than I did about maybe 20 years ago when I was trapped in the insurance cattle hall. I also have multiple online businesses and passive income as well. But for me, it's some clinical and some are not clinical at this point. So we just want to encourage you to think outside the box, to know what's possible, and that you are not trapped. You have control of what you want to do, and that we're here to help you. Join our Doctors Online Success community. The link is down below. And just know that you are not just a doctor, you are the doctor boss.
See you next time.